My name is Brandon Lee, and my presentation is Parents and Their Influence on Adolescent Substance Abuse. So first we need to start off with what it really is substance abuse, and according to Johns Hopkins Medicine, substance abuse is a medical term used to describe a pattern of using a substance, drug, or drugs that causes significant problems or distress to the user. Now, through my research, I did find that substance use is very relative in American society, as around 19.7 million Americans are affected by this, leading to $740 billion lost yearly to this, being it going into criminal justice, rehabilitation, or the loss in the labor force, as according to American addiction centers. But also, the higher in the education system that students are, the higher percentage that they are to use drug use. As in 2021, the 12th graders showed around a 35% uses of illicit drugs. And this is even after the dramatic decrease following 2020, 2021, or also during the time of COVID. The causes of addiction can be brought back to four main things, being genetics, environment, age, and mental disorders. As the genetics of a person can make them more susceptible to drugs in general, making it easier for them to come to an addiction. Now, the environment, with an environment, it can sometimes influence them more to come into drugs or have access to them through early ages. Then age. As a young age, they can be very susceptible to influences, and this can influence them to go into a wrong social norm to, say, their society, which for some is very acceptable. And then mental disorders. Mental disorders can be shown as having a more emotional response to many things, and drugs are what they see as an escape from this. Now, the solution I found to this is parents need to take away time from their day to talk to their children about the risk factors, the rehabilitation methods, and the type of influences they may come upon in their daily life. As according to Healthy Children, as a parent, they have a major impact as it be to stop them from using tobacco, alcohol, and drugs. And it all starts when you first talk to your child and listen to what they have to say. Secondly, you have to help your child make good choices and decide what really are good friends, as this will be something that will influence them later in life. And lastly, you need to teach your child how to say no, as this will determine if they're able to prevent from going down this way of life. The limitations I found during my research are parenting styles, as not all parents are there the whole time to actually talk to their child and tell them how it is. Then age, such as in the namesake, the main character isn't able to understand what the true meaning of his name is, even after his parents talk to him about it. And it's the same way when it's talking about substance abuse, as many will see it sometimes as a way of a punishment than an opportunity to grow themselves. Then viewing a criticism, as I said before, some view it more as a type of punishment than an actual way to prevent them from actually happening upon it. Then surrounding environment. Now, in places such as Oklahoma, Phoenix, and even Nashville, marijuana usage is higher than the rest of the United States, which can be a social norm, leading to them being more accessible, as said before, to marijuana usage. Now, talking about the risk factors for addiction, it can be academics, their physical health and mental health, their surrounding peers and families, and how it can affect them financially. Then the work that's actually needed for rehabilitation, as finding the initial push and motivation to come into rehabilitation and be able to stick with it. As according to the National Institute on Drug Abuse, they have to track people for an extended period of time to make sure first they stay clean of drugs, but also are able to bring themselves back into society as a whole. And influences. Influences are very big, as it can be parents, peers, teachers, schools, and their social life, and there's even more to it. The social motivation that many come across, just try to fit into the social norms or the social cliques, as many can say, is what really influences their big decisions in life. And then their reward sensitivity. What kind of pleasure do they get from it? Is there a way for them to find another way to actually find happiness in it? And then the distraction. As many, such as in a chaotic household, find drugs as a distraction from the overall view of it, and it's just the way that they try to escape from it, because it's cheap and easy. Now, as I said before, my closing conclusion is parents need to take time out of their day to talk to their adolescents about the topics of substance abuse as they can prevent them from turning down this way of life in general. They need to talk to them about the risk factors, discuss with them what can really happen if they do go down this way of life. And the rehabilitation, if say they are already too far gone, and tell them what will happen to them, such as the time that's needed, the motivation that's needed, and the hard work that's needed for them. And then they need to be able to examine the influences, as this is why they need to be able to make good friends in life, as this will influence them in the long run. And teaching them how to actually say no in general, as I said before, it can prevent them from turning down when they try to give them any type of drug or their family. This helps that.
Right. Brendan, what information did you need that you weren't able to find or locate? And then how did you go about trying to find that information?
Well, I first tried to focus on the actual grade levels, and I did find the graph, but it didn't really focus on the certain drugs. I was trying to more focus on the cases of marijuana usage, but I was unable to find it, so I went more into it of illicit drug use. That's why I used the graph that showed the 12th, the 10th, and the 8th graders.
Thank you. All right, second question. What additional questions emerged from your research, and why are these questions important?
Well, one big question that really was raised during it was how did COVID really affect us? Because I noticed during the 2020 to 2021, the dramatic decrease happened. I was wondering how COVID really affected them as a whole, and was it tied into the dramatic decrease? As just as I said before, the 12th graders had a almost 5% change in it.